When you're getting a heart, it's like a daughter-in-law. Yeah. So if you take good care of your daughter-in-law, the daughter-in-law also will take care of your family. The organ is the property of the country. It goes to the Indian national. Even though organ is donated, organ is made to pay for the seat it occupies in all the commercial flights.
So days to life and life to days.
Correct.
Both are important.
Nature is so unique. Every cell of our body understands that this is mine and that is not mine. Somebody is donating the organ, so we need to respect that donor family also. Heart is one organ which needs to be done within 4 hours. You will get one chance to stitch it correct.
Okay.
And yet it has to be blood tight. We have seen our pediatric heart transplants, they do so well. I think one of them has cleared ICSE board exam with a 98% mark and he is now getting into medicine. He wants to become a doctor.
I'm sure the inspiration is yourself itself.
So he'll become a transplant surgeon.
So there's one girl who wants to become a professional dancer. She's already, I think, got selected for the India's Got Talent show.
Wow. Welcome to the podcast. Today we have Dr. Neeraj Kamat, who's one of the foremost cardiac transplant surgeons in the city and the country. And today we are going to speak about heart transplant in general and his journey through it. So welcome Dr. Neeraj Kamat.
So hi Ankur and hi Bhavesh. I think it's one of the very nice initiatives we are seeing here as a podcast for all the people here. Medical, non-medical, layman, everyone. And I'm one of the foremost cardiac surgeons. That's what he introduced me. But I would say I'm a cardiac surgeon and my passion is about heart transplant. My journey to heart transplant is very different. But right through my childhood days and my graduation, post-graduation, I always thought of being a heart surgeon. I wanted to be very close to somebody's heart, always. I always wanted to be a surgeon and always wanted to be related to heart. And I always thought that, pediatrics patients are very difficult to treat and we are very emotionally connected with them. So pediatric cardiac surgery was also one of my passions. As the journey evolved through, it was really difficult on the path from MBBS to MS when I was going through. But I think I got the right people at the right time to guide me. And I managed to get through into one of the prestigious institutes like All India Institute of Medical Sciences, where I could see right from A to Z of cardiac surgery. And that is where was the first place where I could see this something called as heart transplant, which was never in my mind, even though it was happening all around the world.
I believe AIIMS was the first place where a successful cardiac transplant was done in the country, isn't it?
Correct. So heart transplant surgery is really about 40-50 years old. And we are all aware about the first heart transplant which was done in South Africa by Christian Bernard in 1967. But I think we should give due credit to even our Indian surgeons who dared to do it at that point of time with the least infrastructure. And Mumbai was at the forefront where PK Sen, he did the world's 6th and world's 7th heart transplant in KM Hospital in the year 1969. And that happened in a gap of a week. And I think the first patient survived for about 24 hours and the second patient survived a little more. But I think because of the lack of immunosuppression, there was no teamwork, there was no understanding of heart failure physiology and the transplant immunology. And unfortunately at that point of time there were a lot of ethical issues, and then it all came to a halt till in 1994 the Human Organ Transplant Act was formally passed by the Parliament, and that is when the first successful heart transplant happened at All India Institute in 1994 by Dr. P. Venugopal.
When you mean immunosuppression, you said that immunosuppression and all, that was not there at that time. So what do you mean by immunosuppression? What?
So we have policing, in every place we have policing, correct. So whenever we have police in city, it is to stop doing any wrong work, correct? So similarly we have policing in our own body, and that allows that policing any infection coming from outside to attack and kill it. Now what happens is, in transplant you are getting an organ from some other body, and nature is so unique, every cell of our body understand that this is mine and that is not mine. And whenever you have some organ coming from outside into your body, our policing force recognizes it as a foreign, and then like it keeps on trying to hit it, and that's why you need to suppress that immunity, and that's what is called as immunosuppression. So I would like to say here a few things, like I always say to my patients, that when you are getting a heart, there is a difference between being a daughter and a daughter-in-law. When you are
So what's the difference?
so when you're getting a heart, it's like a daughter-in-law. Yeah. So if you take good care of your daughter-in-law, the daughter-in-law also will take care of your family. So it's very important to take immunosuppressions, keep good surveillance with the doctor, and then that heart will be there lifelong with you.
So just to understand from the audience and the layman's perspective, like you have two kidneys, and we hear renal transplants and kidney transplants very often done regularly. Correct. So heart probably is a very unique organ. It's a single organ available. So how easy is it to get a heart for doing a transplant for you guys?
So in India, organ donation concept is still very naive. I would say it is still now improved in the last 10 years, but there is a lot of north-south divide, unfortunately. So the southern states are the ones who are leading in organ donation, and a few western states like Gujarat and Maharashtra, they are also ones who are involved in organ donation, but the northern India is still way behind, and definitely activities are going on at different levels, at government level, at private level, at NGO levels. There are a lot of activities going on, but the problem about it getting spread is because it is a donation, the first thing. Second thing is, it's a very emotional moment for the family to lose their close ones. Probably they are very young, and in that difficult mindset to convince them for organ donation becomes very difficult. And organ donation in India is like 0.03 per million as compared to 1 per million in Spain, which is like, now Spain has come up with the idea of opt out. That means every Spanish citizen is made to donate organs. If you don't want to donate, you have to opt out of the system. Whereas in all other nations, it is all about pledging your organs when you are applying for driving license. And I think in India, either we can start at the driving license or we can start at the Aadhaar card. If we can pledge organs right from that point. So I have one small story to share. We had one foreign tourist in India from Australia who had come. The family of 3 parents and a daughter of 13-year-old. And when she was in Australia in school, one day they taught something about organ donation. And she was so fascinated about that concept of organ donation. Indeed, I'm getting goosebumps whenever I talk about her. She came back home and she was very excited. Mama, today there's something fascinating I heard about, that is organ donation. Have you pledged your organs? So mom said, yes, I have. And what about our father? I don't know. So when she waited for her father to come in the night, and the first thing she asked is, show me your driving license. So he said, why? What happened? No, I want to see your driving license. So he showed, and there was no organ donation pledge on it. So she asked, why did you not pledge your organs? So he said, you're small. When you grow up, you will understand. No, you tell me the reason why I have not pledged your organs. And Mama, you need to convince Dad that you need to pledge organs. And that time the story went ahead, but I think there was a conversation where the daughter said, if by chance, if there is anything to me, I would like to pledge my organs. She was just 13 years old. Wow. And they had come to India for a tourist visit. Unfortunately, in the flight, she had cavernous sinus thrombosis. Oh. And when she landed unconscious. They landed in Bangalore. She went to the hospital there. She was declared brain dead. Then she was airlifted to Mumbai. The recipient was a 6-year-old girl waiting for heart transplant for about 3.5 months.
Fascinating story, I must say. I mean, really, even I got goosebumps hearing that. I mean, just divert, ask you, like, how many of people you know thinking of donating any organs? Do you know of people like that?
Very few. I remember long back somebody had decided and pledged the eyes, right. and in the family, and then at the time of the death and before the funeral, the whole journey of the doctors coming in the house and everything. And I've seen that what Neeraj was saying, it seems very, very traumatizing for the family who is not in consent with that. But I think I'm sure with growing time, like this 13-year-old kid, our population is getting sensitized to getting this pledge done more and more often. Just imagine the happiness and the joy of that 6-year-old girl who got the heart, and I think that's the joy that you can deliver after your.
So I'll share one more story on this. Now the problem is pediatric recipients need pediatric donations because you cannot get an adult heart.
So an adult heart cannot be put in a pediatric.
We can put it, but then it needs to occupy that space. So there's something called as big heart syndrome which can happen in a pediatric recipient. I think last year, December 31st, there was one donation and we accepted for one of the recipients whose birthday was also on the December 31st.
Oh.
So can you believe it? So his original birthday is December 31st and he's getting an organ on the same day.
Neeraj, you're coming more across as a storyteller. I mean, there's so many fascinating stories.
So you might say it is coincidence, but I don't think it is coincidence. There are these are really.
And I think us being doctors also, we feel emotionally connected to something like this. I'm sure general population who understands the value of this would get connected to something like an organ donation and a pledge to that. Suppose if somebody wants to do a donation, how easy is it? Is it just a phone call away, or where do you go and do that?
There are organizations in Mumbai like ZTCC is there. And even when you are applying for driving license, now there is a question about organ donation. You can pledge your organs. It's not compulsory in India yet. They have come up with a question where you can pledge your organs because in Indian system still, the family takes the decision for the person who is unfortunately brain dead.
So Neeraj, brain dead, you keep on saying this brain dead. So you mean to say a dead patient, you cannot transplant the organ, it has to be brain dead. So what's the difference between brain dead?
So I think as doctors, when we have gone through our internship and all, we have all certified deaths. And when we certify deaths is when we see that there is no pulse in the body. But actually, if you see in a layman's language, we say the birth is with the first breath. And we say he passed away taking his last breath. So it is the breaths which decide the life and not the heartbeats. So now when I say brain dead, the difference between brain dead and coma is what people are confused about. So there is something called as respiratory center near our cervical spine. And whenever that respiratory center stops, that is when your brain is disconnected from the body. So when your brain is disconnected from the body, your body might live for probably 24 to 48 hours. Eventually, the body will also succumb. But in that brief duration, if the family is willing for organ donation or if the person himself has pledged his organs, you can go ahead and take heart, lungs, liver, kidney, cornea, pancreas, intestine, bones, skin.
So you can do multiple as well, like this?
Yes. Depending on the recipients, you can decide what to take.
Fascinating. Let me summarize this. So you mean to say brain dead means the brain is disconnected but your heart is working,
Correct.
there is circulation maintained to your body, the other organs of your body are getting perfused, so you can take those organs and donate it to others.
So there are formal neurological testing parameters called as apnea test, where we disconnect them from the ventilator and see whether they can take their breaths or not, because breathing is an involuntary, means it's not in your control. You will continue to take breaths till you are alive. That is an involuntary response from your body. So in apnea test they do is they test whether you have that center active or not. So a difference between a patient who is comatose and brain dead is that comatose person will continue to breathe, but his brain might be damaged to an extent which is irreversible, but he will continue to breathe. Whereas in brain dead, your breathing center is gone, so you are officially declared as brain dead. Comatose, you are not brain dead yet. There is something called as DCD donation. So this is called as DBD, donation after brain death. And DCD is donation after circulatory death. So in those patients, they can also be converted to organ donation. But in India, because of the emotional and ethical issues, that has not yet come up. I think last month there was an article in Nagpur. They did the first DCD kidney donation. Okay. Means that patient was not brain dead, but the brain was massively damaged and obviously wouldn't have recovered. but he was breathing.
But is it legal?
The process is going on to make this legal. In all other Western countries, this is legal all over the world. But in India, it is still at a very, very nascent stage. But we are coming up with newer guidelines to speak with the government of Maharashtra, government of India, because that will increase the donation rate.
So you mean to say government has also a big role to play here?
Government has the major role in this, because this is not like kidney and liver where you can donate from your close ones. This is purely the heart, lungs, they are purely from brain death donation. So this completely comes through the government. So you might get some messages, somebody's close relative has had something and they are ready to pledge organs and please contact so and so person. That is a false message, because it never happens like that. If that brain dead person is in the smallest of the smallest hospital, and if he is brain dead, he will be shifted to a bigger hospital which has license to donate, and then it will go through a formal neurological testing. There will be 3-4 people who will be giving the certificate that he is brain dead. Only then the donation will happen.
I mean, I've seen a message, viral message, keep on coming even years later.
No, I keep on getting it. Now that my family, everybody knows I am into transplant, they get message from anywhere, from Karnataka, from Andhra, and they will message me there is an organ available, and I say don't worry. If it is there, it will come through the official channel.
Okay.
And
so you mean to say there's a list here of people who require donations?
Correct.
Is it in level of priority or is it in level of time?
It is on the timing of registration. When you register that recipient with the government body.
Okay.
Now, but unfortunately in heart, it is not always like they are stable.
Right.
It's a very dynamic thing. So when they become unstable and you have to put them on some machine, that is when you can bypass the other recipients and become supra urgent. So there is a process to it. So whenever
who decides this?
there are committee members which have cardiologists, we have cardiac surgeons and neutral people in the government body. And whenever there is an organ involved and whenever you are registering an organ, there will be a communication with the committee members.
Okay.
I'm seeing a cardiologist sitting and a cardiac surgeon sitting here. Just to understand that, obviously I've heard of devices which are used in heart failures from a cardiology side,
Right.
which can improve the pumping and everything. So when do you decide that this patient now needs a transplant, or this patient can be managed with a cardiology procedure?
So there are MCSs which are available, mechanical circulatory support, which are there. See, if I want an organ today, as he said, there's a long list which is there. So I'm not going to get it today itself, right? So I need something to stabilize so as to I get the organ. So there are circulatory support devices which are available like ECMO. Then there is something called as Impella. These are the ones which help you help your heart maintain the circulation.
So when, as he said, heart is not available on the shelf, like you have the walls available. Or so whenever there is a patient for transplant or consultation, I said, if your heart transplant is a 12th standard exam, coming to a visit to me, you are in the 8th standard and you need to clear your 10th standard, where we will decide whether you will be going for science, commerce, arts, or I think 10th is what you are destined for. What it means is, when he comes, he will be on all the heart failure medications. When we do transplant, as I said, the organ is from somebody else's. Our body is not going to accept it. So these immunosuppressions, they do hit your body. And here I'm not too much worried about the heart. I know that we are going to transplant the heart, but I need to know the rest of his body. Because the job of the heart is to give blood to the whole body. And if his kidneys, livers, lungs, all those organs are also damaged, then it becomes a multi-organ problem. And then the success of transplant is not
So
great.
you mean to say heart transplant not only should be done, but should be done at the right time, right? Because what I see and my experience has been with seeing heart failure patients is, when you say heart transplant, the entire family just shuts their brain, It's as if, you've written a DC and kept, and, heart transplant, they mostly see it as a problem rather than a solution. That's what I've seen in my, and I've lost patients, very young patients, I've sent to you as well, that. It's young patients which I felt would have done very well on heart transplant. And money wouldn't have been an issue in this case. I know transplant costs money, and also money beyond the transplant, after the transplant is done. People have just shut their brains, not thinking of, that this is a solution to their problems. How do we change this perception about transplant in general and heart transplant in particular?
I think that heart transplant word is more of a taboo now. The people, as soon as you say heart transplant, they just want to wind up and just come back home and, just be on medicines. So what you can say is, we have come to a stage where there is a limit for everything. And medicines have reached their peak. And now you might need something more than medicines. You might need some sort of a surgical management of heart failure, which involves mechanical circulatory support as well as transplants. So when I say that they are in the 8th standard, so they need to clear the 10th standard, and that is called as a pre-transplant workup, where we admit them for about a week. We get all the blood tests done, investigate the lungs, the liver, everything. We get all the information from the body, because donors might come in the middle of the night, and at that point of time I cannot investigate the body. Somebody is donating the organ, so we need to respect that donor family also. So if this recipient family, if they have some psychiatric issues and the patient compliance is very poor, obviously she will do very well with transplant, but after 2 years if they stop taking medicines, that is when the problems might start. So all this workup, we will come to a conclusion, yes, we might end up doing only heart, or it can be a little high risk heart transplant, or she might need heart and lung both, or she might need VAD, ventricular assist device. She might not be fit for heart transplant because she might be having a lot of antibodies in her body, like we have allergies, correct? Peanut allergies, not all have peanut allergies. Like COVID behaved different in different people. So similarly, if your body is having all these issues, organ might get rejected very easily. So in that case, the ventricular assist device is the ideal treatment.
So you mean to say, in the policing which you said,
correct,
right? That's the reason for organ rejection, and that's why your immunity has to be suppressed.
Yes.
But when you suppress this immunity, do you get infections also? Have you seen bad infection? Because TB is one thing which is all around in our country.
The good part about the heart is a very, very protected organ. It's unlike lungs and intestines, which are exposed to the environment every day.
Right.
Correct.
Right.
Heart is a very, very protected organ, and that's why if you have a basic immunosuppression module, they do really well.
Okay.
Now the magic about heart transplant is, in heart failure, the amount of restriction you have, like going to the washroom, you will become breathless. Walking 2 stairs, you will become breathless. After heart transplant, you will be absolutely normal. Your quality of life will be absolutely normal. And I always tell my patients, me being a doctor, and I think you will also agree to this point, that even though on our examination paper we write that we increase the survival, but we cannot increase our own survival, isn't it? Even if we are doctors, I cannot increase 1 minute of my own life.
Right.
I think 1 minute is too much, not even a second, isn't it? We are destined for whatever we are.
Right.
But as doctors or as other family members, what we can change in the patient's life is their quality of life.
Right.
They might live for 60 years with heart failure or 80 years with heart failure. But with transplant or VAD, if she can have an active life for that 80 years. And
Absolutely.
that is what is, I think, the game changer.
I think days to life and life to days.
Correct.
Both are important, right?
Correct.
So quality of life is as important as how much you live. I mean, let me summarize what you said,
And we have seen our pediatric heart transplants and the adult heart transplants, they do so well. You will not believe the pediatric ones, they have grown now 6-7 years. I think one of them has cleared ICSE board exam with the 98% mark, and he is now getting into medicine. He wants to become a doctor.
I'm sure the inspiration is yourself itself.
So he'll become a transplant surgeon.
So there's one girl who wants to become a professional dancer. She's already, I think, got selected for the India's Got Talent show.
Seems amazingly emotional, the whole thing. But just to come to the practicality of it, you mentioned that heart transplants can be required in the midnight as well. How do you bring that? That suppose if a donor is, say, in Pune, or a donor is somewhere in Nanded or some smaller town in Maharashtra, and the recipient is in Mumbai. So how do you bring that? Because it's not easy, isn't it?
Even in a country like India, where we have so much of bureaucracy, VIP culture, but there are certain basic core values which are extremely inculcated in all of us, and I think even the government officials, the police, we are all on our toes when it comes to organ donation. And now the police is so aware about organ donation, they can go to any limit to help us.
Sorry, Neeraj, police? What does the police have to do with the...
So for example, he said if you have an organ from Pune. So there are zones. How it is divided is, Maharashtra is divided into 4 zones. And so they are called as ZTCC, Mumbai, Pune, Aurangabad and Nagpur. And then these all zones become a state that is called as SOTO. Then there are 3-4 states which come together and it becomes a regional office, that is ROTO. and then it becomes a no-to. So whenever a donor is available, and if in that local area, if there is no recipient, it goes to the next level, that is SOTO. Then it goes to ROTO and then NOTO. Now, suppose we have an organ from Pune, and there are coordinators to coordinate with the police, with the team, because heart is one organ which needs to be done within 4 hours. So the travel time and the stitching time is 4 hours.
So Mumbai Pune traffic, so sometimes you might get stuck, no? 3 hours on the traffic itself.
So the full credit to Mumbai police, So we come by green corridor in 90 minutes from door to door, from hospital door to hospital door. And you will not believe the coordination between 5 different police: Pune city, Pune rural, Mumbai Pune expressway, Mumbai suburban, and the Mumbai city police. There might be around 300 policemen on the road.
Wow.
Arranging the green corridor. So the whole meaning of green corridor means you will get all your signals green.
Oh.
And your vehicle will be escorted through the traffic. So the traffic comes to a standstill at that area whenever we are
So
passing.
if Modi ji is on the way, what
So when we are coming from the airport, on the ceiling, and I think the CM's convoy was going the other way, and they made the CM's convoy wait till we passed them. So that's what I said, the police have a lot of strength, power, and a lot of willpower to do that. And even in a country like India with such a VIP culture, it was really nice to see the amount of coordination required. Sometimes we come by commercial flight. Now we have traveled by Vistara, Indigo. The first time we traveled by Indigo, it was very difficult to convince them that, see, heart is one organ. Whenever I stop perfusion in the donor, I have to travel, I have to stitch it back within 4 hours. And unfortunately, initially the commercial airlines, they have a fixed time to take off. If they delay it, they are penalized. So they used to keep on telling no, they have to come according to their seat numbers. So we have to tell them this is what it is. And then they agreed. So now even the commercial airlines, they are aware whenever an organ is traveling, they will make sure the first 5 seats are for the transplant team.
Oh, is it?
And organ pays for the seat.
Wow.
Even though organ is donated, organ is made to pay for the seat it occupies. And we are the last to enter and first to go in all the commercial flights.
So nobody gets up taking their bags immediately as
No,
the
so
flight.
they all make a formal announcement that we have an organ traveling, and please be seated till the transplant team is escorted.
So do you also go down and come back?
Yes, it's a big family. It cannot be done by one single person. It's the surgeon, the cardiologist, the anesthetist, the intensivist, the ID specialist,
What is ID specialist?
infectious disease specialist, the physiotherapist, the social worker, or we call it as a transplant coordinator, the psychology evaluation, and a psychiatrist. These are the core people who are involved, and there are a lot of other support staff.
Okay.
So once we had one family who was staying in, I think, Mumbai Sion. The 50 people were staying in one room.
Oh
50
my.
people.
It was like a joint family.
Oh.
And one of the members had to undergo heart transplants. In that pre-workup, everybody comes up with a yellow flag. See, I will be looking through my surgeon eyes. I cannot look through the physician eyes, or I cannot look through other eyes, isn't it? So, but in transplant, surgery is a very important part of transplant, but it is only 30 to 40%. The rest, all these things are important if you want a good survival. So, social worker, I was saying, so he came up with a point that this person is having a family of 30, 35. So after the transplant, I don't think that will be an ideal situation, he going back and staying there. So we made them rent a small house, and then patient with his close family members, they shifted to the new house.
Oh,
So with transplant, he got additional bonus of a new house in Mumbai, which is a dream.
So coming on this, like in India, joint family system and so many people in the family, does it ever happen that a person has pledged the heart and then the family members don't allow the heart
No,
to
so
be
if you have pledged, the family members have no role, have no say at all.
Okay.
But the initial rules were that the parents only had to say. Now all those things have been diluted. Now even the first cousins, if they say that we can donate, and then
What about pediatric consent?
pediatric, the parents or the guardians need to consent.
So how much does this cost, like the entire heart transplant?
We always try to say that transplant surgical cost can always be taken care of, even though it is around 20-25 lakhs. A standard heart transplant, and if you are doing any high risk heart transplant, it can go up to 30 lakhs. You can still get a support from a lot of NGOs, government for the surgery. But the key thing in this is post transplant, they need to be on medicines for the rest of their life. And I don't think anybody can support for the rest of your life. What we try to do is we tie up with companies, whatever blood levels and all those things to be done. We subsidize, we give discounts and all those things, but the medicines they need to take for the rest of their life. And that costs around 8,000 per month. The first year is around 10-12,000. But from the second year, it comes to around 6 to 8,000. And yearly once biopsies for the first 5 years. After that, we don't do any biopsies. It's about 8,000 per month. For the rest of their life, they need to keep on taking. That is very important because nobody will support you for that.
So, Neeraj, talking about the cost, seems like an exorbitant cost and over a period of time, expensive, cost intensive. So do insurances cover? When somebody takes an insurance, do they need to specifically ask?
Yes. So in I think insurance, they have started to cover transplants, all transplants indeed, not only heart. There are a lot of catches in it. So I think when you are taking any insurance policy, you need to make this point very clear that, if I'm undergoing any transplant, how much would you be covering and all those things, because they have certain clauses in this. But yes, transplants are covered in insurance.
What about government insurance schemes? Like, I think renal transplant does have somewhat in
MPJY,
which is the Maharashtra.
I don't think presently there is majorly any support from the government. Unlike few governments in the south, and I think the Gujarat government, they have come up with some policies. But the Maharashtra government or in the national level, things have not come up. Okay. They do help. If you apply to them, they do help with some amount.
So that means if they privately go to CM fund and ask
Correct.
for the chief minister's
Correct.
office.
So there are a lot of NGOs and CM fund and this and that through which you can do crowdfunding. And so basically your contribution will be really like probably not more than 20% to the whole amount. The rest 70 to 80% can still be managed through crowdfunding.
So coming to crowdfunding, so there are lots of people doing this crowdfunding. You see in YouTube ads also lots of it. But sometimes it's very difficult to differentiate the genuine people from those who are not.
So when you decide that this patient is going for transplant, there will be only one account in which the money will be coming, and that is in which hospital he is getting registered.
Okay.
So there is no foul play in it. So there is only one account, and normally what you do is there is a credit note which is sent to the hospital, because transplant might happen after 1 year.
So what is credit note?
So credit note means the organization, whoever is supposed to give the money, they will say that we are promising to give you this money at the time when he undergoes the transplant.
Okay.
So on this point, like say as we spoke of some remote town, where like as you said, commercial airlines, and now there is no airport or not a regular flights going because only one flight is there in the day from that town. So then how do you deal with all these things?
So there are a lot of private aircrafts which are available, not the air ambulances. There are a lot of private aircrafts which are available.
Chartered flights.
They
charge you lesser than air ambulances.
So it's a little bit of a gimmick there, because there is no standardization and there is no regularization about the amount they can charge. It's like Bombay Stock Exchange. It just keeps on going up and down.
Okay.
If there is heavy traffic for them, they will increase their prices. But now we have a lot of friends in it. We are now regular travelers, so they do, and they understand that organ is a precious entity.
Right.
So they will also respect it, and they will not overcharge, but they will charge for whatever, because parking fee on the airport and all those things are very costly. But it doesn't go not more than normally around 5 to 6 lakhs.
Otherwise, I think air ambulances go upwards of 8 to 10 lakhs,
Yes.
right?
Air ambulances are completely different, because there you will have oxygen ports and all those
That
things.
you don't require.
That we don't require for organ transport.
Has there been an instance where you were not able to bring the organ on time?
No. So it's never happened that we have not come. But yes, there has been some delay somewhere or the other because of the weather or because of the technical aspect. I think once in Delhi, we were supposed to go to Terminal 1 and there was some communication gap. We landed in Terminal 3 and then we had to come back to Terminal 1 where our private aircraft was there. So these things do happen, but because the awareness was less. This happens when it is new. Now, especially where we are working, in majority of the donations coming from Gujarat, Maharashtra, Goa, and this side, more or less everybody is aware. Whenever there is a donation, everybody has their job role and they just stick to their job role and all make sure that the organ has to reach on time.
Do you guys do drills?
So we used to do it when we started. Now we have crossed that stage where we need any drill, but we keep on checking with the coordinator and the police whether you are aware, because sometimes what happens is in retrieval there is always a delay.
Retrieval means retrieval of the organ of the
correct.
heart.
Of the heart, of all the organs.
All the organs.
If the family wants the body by 10 o'clock in the morning, you need to start the retrieval at least 4 hours prior, correct? If I have to reach at 5 o'clock in the morning, I need to plan according. So it requires a lot of coordination. Now sometimes what happens is the liver team will say that I will need more time, and then we have to change the timings.
So
when-
it's like the heart is taken, the pancreas can go elsewhere, the lung can go elsewhere.
correct. Yeah. So everything will be going at different places.
So there are multiple teams coming in.
Multiple teams coming in. So that notification has to go to everyone.
So that's hell of a
So
coordination.
recently,
Absolutely.
I saw a leading hospital, and then 3 different hospitals had sent 3 different teams to take. Somebody was to take liver, and somebody was to take heart, and that's how it happened recently, I think.
That's so much of coordination. I mean, is there a person who does that? Like one person who's
every
at the
team-
government level, or how do the teams coordinate between?
So the government level, whoever is distributing the organs, they have to be notified because they are the responsible people, and each organ, whoever comes, has a coordinator with them. So they coordinate with the police now that the first heart will go, then probably the lungs or liver
So
will
which
go.
is the first one to go? Like
Heart is always the first.
heart
one to
is
go.
always. And what can go last?
Kidneys.
Okay.
They can have a cup of tea, they can have some sleep, and then to go and do the
So
transplant.
you get the priority. So when you come, you are the first ones to take and go.
Yes.
Okay.
Because we have to stitch it back within 4 hours.
Fantastic.
Because
That's so
that will give the
fascinating.
best outcome to the patient.
Even as doctors, it's so fascinating
I
for
know,
us
I know,
to,
I know.
you know, for
So
us.
for a heart surgeon who is into bypass surgeries, wall replacements, congenital surgeries, transplant surgery wise, nothing has much changed in the last 30 to 40 years. If you see what the first heart transplant surgery happened, the surgery wise it is the same. But what is important in that is you will get one chance to stitch it correctly.
Okay.
And it has to be blood tight. But what has changed in these 30-40 years and has come to this success is the understanding of heart failure, transplant immunology, because immunology is one science which has kept on changing,
So
evolving.
immunology is
The
again
post-transplant-
the post-transplant medicines.
Correct.
So
And
as
the
to
re-
suppress your immunity to accept the foreign organ.
And the retrieval techniques. So I'm writing a paper on this about the recent retrieval techniques. We are still doing what majority of the world is doing, that is we take the organ in the ice box. Now there are different methods of retrieval. One is called as the beating heart retrieval. We are all aware about beating heart bypass.
Right.
There is something called as beating heart retrieval, and there are few other ways of doing the retrieval.
So beating heart
where you
retrieval
can
means what? Like
so
the
the
heart
heart
is
will
be-
keep on beating. So
Oh.
heart likes to beat. Job of the heart is to beat. It
Yeah,
doesn't
yeah.
like to remain still.
The rhythm of life.
Correct. And it doesn't make noise. Whether it sleeps, you're watching World Cup final, you're giving an interview, you are in front of your girlfriend. It does its job quietly all through its life. Correct. It doesn't like to remain still. That's why if you keep it beating, you are basically allowing the heart to do its job. And they supposedly do better when you do the transplant or when you do the implant. As against you put it in the ice box where you're keeping it in the ice.
And still.
I think we are all aware we keep all our fish and all those material in the freezer, and what you take fresh and what you eat from the freezer, there is a change in the taste.
There's difference.
Those who are really taste and taste can easily differentiate whether this was kept in the freezer for a long duration of time as against getting it fresh.
Absolutely.
So same is here. The longer you keep in the ice box, the more injury the heart can have. Even though it is reversible, but still. But now we have a lot of gadgets which are coming up to support the heart. I remember 20 years back, dialysis was a taboo. As soon as you utter the word dialysis, they used to feel that now I think days are counted for any individual. For kidney failure, I'm saying. Similarly, there are a lot of machines to support the heart. Either you can use it before the transplant or you can use it after the
So
transplant.
you mean to say the LVADs, right? Left ventricle assist
Correct,
device.
correct. Like you said about ECMO, the common word what we see is mechanical circulatory support, but it comes with a lot of gadgets. It's called as ECMO, it is called as LVAD, it is called as RVAD, it is called as BiVAD. So there are different configurations which give the different name.
Right.
But the principle is simple: to support the heart and the lungs. And
So that
heart
means
and
there
lungs,
is-
they work like husband wife. Yeah. So you have to be cordial. If your heart is not doing well,
The lungs filled with
the
water.
lungs fill with water.
Right.
So you have to support both.
Right. Talking about LVADs, so there are a lot of devices to support the heart, like HeartMate 3, HeartMate 2.
Correct.
So this is basically to bridge it towards till we get the heart, for the heart transplant. These devices, can you just put them inside surgically and just lead your life as you can?
Yes,
Like
yes.
normally without requiring a heart transplant.
So these devices are basically bridge to something.
Right.
Now that bridge can be to recovery. So if suppose you have had a recent heart attack and because of this heart attack your pumping capacity has gone down. Now what has happened is any sudden change in the body, your kidneys and liver are not used to it. So they take a hit. So that is where the role of temporary devices come. And that can be bridge to recovery or bridge to transplant.
Bridge to recovery is the patient recovers, then you remove the MCS.
Correct.
But if he does not recover, then he requires a transplant.
That's why you need to do all these things in a center which is equipped with all these gadgets and understanding of all these gadgets. Because if it doesn't recover, the average duration what we say is 2 to 3 weeks.
Okay.
But we come to know in the first week, if it has to recover, they normally start doing well on the 4th or 5th day. But if they are not doing well, you know that he's going towards the transplant pathway. So I'll tell you one story. So we had one young girl from I think Goa. She was stuck on ventilator. I think she had viral myocarditis.
What is viral myocarditis?
We had COVID infection. Everybody had COVID infection, and we all know COVID affected the lungs.
Right.
But we all also know that COVID had a lot of other side effects also.
Right.
And one of the side effect of viral infection, it can be any viral infection, is on the heart. Unfortunately, the antibodies which are produced to kill the viral infection, they go and kill the muscle protein of the heart, and that is where the problem of viral myocarditis come, where your pumping capacity goes down from 60% to like 10% or 5%. And then she was stuck on ventilator and she was throwing lot of arrhythmias, that is the rhythm disturbance is what we call.
Right.
And that's why the pumping was not coordinated and rhythmic, and that was affecting her liver, her lungs, her kidneys. We went initially to stabilize
It always happens, right? When the heart gets affected, your kidneys and liver, it's like the orchestra where one instrument, if it goes bad, the others go bad, right?
Correct. And the beauty of heart is, majority of the time it is still reversible. You know, heart is a very dynamic thing. You give rest for a few days and it again comes back to at least a reasonable capacity where it can give you a good support to the body. But once the kidneys and liver get hit, there are no gadgets for liver.
Right.
So
what you mean to say is when the heart pumping goes down, there is a chance that this might recover.
correct.
With by itself or by gadgets to help
You have to support it.
Right.
You have to give rest to the
Right.
heart. So this girl, she was stuck there. Then we came to a conclusion probably she might need a transplant. So we put Impella for her, and we got her to Mumbai.
Impella is
one of the mechanical circulatory support. It's like a LVAD.
so it supports the heart. Without
the
opening the heart, you put one more heart.
Correct.
So two hearts were there in her.
So whatever her 10% was there, the rest 30-40% the machine was supporting.
Fantastic.
So basically you make the multi-organ problem a single organ problem. And once it is a single organ problem and you do transplant, the success rates are very good. We managed to get her out of Impella on medicines. We did some optimum medical management. We got the gadget out. She was looking little bit stable. Even though she was having heart failure, she became little stable on the medicines. But she was stuck on few medicines, and as soon as those medicines we used to stop, her blood pressure used to fall to 70. And she ended up waiting for organ for 3 months in the hospital.
3 months she was in the hospital.
3 months she was in the hospital.
On the ventilator or not on the ventilator?
No, we got her out of ventilator.
Because you put the Impella.
Impella, correct. We got lungs better, liver better, kidneys better. We got her out of ventilator. We removed the device, but she was stuck on the medicine.
We do a lot of Impellas as cardiologists, especially when the heart pumping is low and you know there is blockages everywhere. Impella is one device where you put it from the leg, go right across into the heart, and then it acts like a pump. So you have two hearts inside, right? One, your own heart pumping, and the other one is that. But what I've seen is the knowledge about this therapy is so dismal, even the non-cardiologists don't know about this therapy, that there is something to support the heart when the heart requires it, that too without opening the heart.
See, as things evolve, if you see all our passenger vehicles, they have become more and more safe as times have gone by. Isn't it? So initially we did not have seat belts, then seat belts became compulsory. Then we had the airbags. You pay for the airbags.
Absolutely.
Even though you are not using it, you pay for the airbags for the catastrophe. So when we are doing any medical procedure, it has to be how safe we can do for the patient. Like putting an AICD, you put an AICD whenever there is a heart failure patient with arrhythmias.
AICD is basically a device like a pacemaker. When there are bad rhythms, that you might not reach the hospital. There are bad rhythms which is called ventricular tachycardia. These are patients where you get your rhythm very fast and you require something as a safety device which shocks it and converts it back to a normal rhythm. So AICD is one of the things.
It is like a airbag. It will come to use only in an emergency.
Absolutely.
But that is not going to change the heart transplant or heart failure journey. So however, all these procedures, however safe you can make it, because we are in the 21st century, we shouldn't make it more and more unsafe to the patient. We should make it more and more safe as things evolve. So like when you're doing certain like high risk angioplasties, you said use of impella is fantastic, because then you can concentrate on your job and you don't need to worry about the hemodynamics,
About the pumping of the heart, because
about the pumping of the
you
heart.
have two pumps inside,
So,
right?
Correct. So here also what we try to do is we are making the heart transplant journey safe. When you put on these devices, like recently we had one heart failure patient who was registered for heart transplant for the last 2.5 months, and one fine day we get a call saying that sir, I'm not feeling well, and I think I'm not passing enough urine, I'm not passed for the last 10-12 hours. And we thought that something is not right, and we called him to the hospital. He was in a state of arrest, actually speaking, and we just intubated him and we just took him to theater, and we put him this device called as BIVAD. So it's a temporary ventricular assist device where
Temporary
the pumps are
heart.
outside the body. So you basically divert the blood from the heart, it goes into the pump and is given to the body. So you're keeping all your other organs intact
Till you get a heart.
because he's already registered on the transplant list.
Absolutely.
And then we put him on the supra urgent list. So when you are on the supra urgent list, he bypassed the 3-4 recipients ahead of him. Once he went on the supra urgent list, so anywhere in the country, if there is an organ available, he will get the preference. So he got an organ on the 5th day, and he got discharged. He's doing absolutely fine.
I mean, beautiful and fascinating stories. As doctors, they are emotionally moving to all of us as well, and I'm sure the general population will understand and learn a lot from this.
There was one 67-year-old gentleman who had 12 heart failure admissions in a span of a year. 12 heart. Every month he used to get admitted. He used to take IV, some intravenous injection. As soon as the water from his body used to come out, he used to feel better, and he used to say, "Yaar, what a fantastic doctor I have. He just, he gives me 2 medicines and I feel absolutely fine." And after 15-20 days, again the same problem. But the native problem was his heart pumping capacity was only 10%, and he was 67-year-old.
Was he ready for a transplant to begin with?
So we were convincing him for transplant, but because his age was 67, 68, normally after 65 we don't like to give organs, because organ is a property of the country, and that's why we try to give it to younger people who can contribute to society.
That's a good concept, huh? Organ is the property of the country.
Property of the land. Okay, so then we put a HeartMate 3 device for him, Alvad.
Okay.
And you will not believe, on the 4th day he was out of the ICU, and we came for rounds, and he said, "I'm very sorry, today is 31st, and he had his own business."
Oh.
And he said, "I have around 100 employees working for me, and I have not released their salary, so and I have to do few things. Can you come in the evening and meet me? I'm absolutely fine. You don't need to worry about me." That is the beauty of these devices.
But they cost a bomb, right, Neeraj?
It does cost. Everything comes at a cost. But in India, the problem is every system is cost driven. In India, you always think first is the financial jugaad.
Right.
But I think.
But I'm sure we'll come around for.
I think.
At one point in time, heart angioplasties were very expensive, and in today's times, if you see everybody can afford it. I don't think so there is anybody who cannot afford. The costs have come down. Government has put a lot of effort. Hospitals have put a lot of effort. I'm sure heart transplants will happen.
I can tell you that there are paying patients also. It's not that patients are not paying. And there are a lot of organizations. I'll tell you, there was one a Goan patient who was working for Merchant Navy. He was on the Pacific Ocean in the times of COVID, and he had viral myocarditis. He got admitted in a hospital in US. He's like 35-year-old. So he got admitted in US. They did all the stabilization, optimization, and they came up that this heart is not going to recover and he needs a heart transplant. They did all the evaluation. And after the evaluation, they said, "Okay, fine, you need a heart transplant. Unfortunately, you are an Indian citizen, so we can't offer you heart transplant here. So do you have any centers in India who do heart transplants?" So then the company for whom he was working, they found out that, okay, there are 2 centers in Chennai and 1 center in Mumbai doing transplants. So they took the interview of all the centers, and he was based in Mumbai. So then they said, we will deport him to Mumbai. So they did it over a period of a week. So they got him from US to Ireland to England to Middle East and then to India. He came to us, we got him again evaluated, stabilized, optimized. In the times of COVID, it was in the year 2020, September. And then he got an organ after around 3 months of being here. Because in COVID, actually, what happened was everything was at
Yeah.
a standstill. So organ donation rates were very poor, and we told him that we don't know when you will get an organ. You will have to wait. But the organ is the property of the country. It goes to the Indian national. It's preferred to go to the Indian national always.
Preferred to it.
Yeah. So if on the national list, if there is no one, then they might think for some international patient. But the rules are very, very strict, and they will make sure that most of the time it goes to Indian patients.
I think Indian ethos, giving daan is always given priority in terms of it gives a lot of peace, it gives a lot of things, and to that extent that we've had all the mythological characters also giving daan, and I remember Sita getting harmed while trying to give daan. So
The concept of daan and the concept of transplant is always there in our mythology. I think we first say Ganpati is our first recipient of face transplant, isn't it? So I would like to say, I would pledge that I think Angadan is the Shreshth Daan, and that is the best gift you can give to anyone. You can save around 8 to 10
And
lives.
you can live longer through that patient, right?
Yes.
I mean,
And he can contribute to society.
and you can give contribution.
exactly,
You
you're
can
able to
contribute
contribute to society even after you're not there. I mean, what more can you do?
Absolutely. So fascinating. I think it was a wonderful discussion. The entire discussion was so fascinating, and I should thank Neeraj for doing such a great job. I think heart transplants are so understated in our country. I was just doing a research of how much Indian content is there on heart transplant. I couldn't find any, So I think through this podcast and through this, medium of ours, and I think more and more people will come to know
I
about
would say
the
the younger
facets.
generation who are more social media friendly, the kids, they are already so aware about how to use internet.
Absolutely.
We still misuse, but I think they are more smart enough and understand what is good and what is bad. And I think this initiative, what you have thought of, is wonderful, because when they see it and they understand what is organ donation and how they can contribute to society, I think we all want to contribute to society somewhere or the other. We are all have our own struggles, but somewhere or the other, the larger goal in life is to support the society, contribute. And I think pledging your organs, I think that is the simplest thing you can do.
About whenever I ask people as what do you want to do, with life, now you've achieved everything, many doctors, like, they're the pinnacle of everything, like, they're the best in their field, they have all the money on the earth, they have everything going for them, So my question to all of them is, what do you want to do now? You have achieved everything. And the one word I get more often than not is legacy.
Correct.
I think this is a legacy which can last more than anything else when you donate your organs to someone whom you don't know, you're not met, but then it's just fascinating. The entire podcast was a learning for me more
Yes,
than
absolutely.
Every transplant is like a Bollywood story, I would say. We have our own challenges, new stories, something or the other keeps on cropping up for every transplant.
So I won't be surprised, Neeraj, you acting in one of those transplant movies. Soon Karan Johar or some Sanjay Leela Bhansali should get excited by this and make one movie on you.
Great. Thank you very much.
Thank you very much.
Thank you. Bye.